Have you ever actually wondered how your eye doctor gets so incredibly comfortable putting sharp tools right next to your pupil? Well, welcome to this explainer. Today, we're pulling back the curtain on a third-year optometry preclinic syllabus to see exactly how these hyper-delicate procedures are learned. We're looking straight at the instructions for clinical optometry practice, and we're zoning in on foreign body removal and epilation. It's an absolutely fascinating glimpse into the precise, microscopic training that goes into protecting our vision. So, let's be a fly on the wall in that lab, shall we?
Here's our game plan for today. We're tackling 3 distinct procedures. First up, assessing the threat and removal. Then, the art of epilation. And finally, the perfect saline rinse.
All right, diving right into Section 1, assessing the threat and removal, high-stakes preparation. So taking a patient's history is absolutely critical here. The very first thing an optometrist has to figure out is the exact nature of the injury. We're talking about a crucial distinction. Is the wound penetrating, meaning the object is actually stuck inside the eye, or is it perforating, meaning it went all the way through? Differentiating between these two is literal ground zero. It's the essential first step before you even think about moving forward with a physical exam. Before any treatment happens, students have to master this strict pre-procedure checklist. Vision gets recorded, a slit-lamp exam is done, they check the depth of the foreign material, and they avert the lid. They also use NAFL, that's sodium fluorescein staining, to literally illuminate scratches on the surface of the eye with this glowing dye. Now, just a quick aside, the syllabus actually knows that for this specific preclinic practice day, they skip these preliminary steps so they can jump straight into the mechanical practice. But make no mistake, this checklist is the absolute bedrock protocol out in the real world.
Okay, moving on to the main event, the primary tool for extraction. It's a sharp 25-gauge needle. Now, obviously, you can't just start learning to safely wield a needle near a classmate's eye, right? That's a huge no-go. So instead, students develop this incredibly high-stakes muscle memory by practicing on animal eyes. They're actually instructed to work on multiple foreign bodies placed on an animal eye just to build up that absolute essential precision.
What I love about this is how such a terrifying concept is broken down into a highly controlled 3-step choreography. Step 1, hold the needle tangential to the eye. You never ever point it directly at the eye. Step 2, give a gentle nudge right under the edge of the foreign material. And Step 3, use a swift flicking action to remove it. Tangential, nudge, flick. It's this highly specific, almost robotic mechanical movement designed to clear the debris as safely as possible. But wait, the job isn't always over once the object is out. Sometimes you have to clean up leftover abnormal epithelial tissue. For this, practitioners can either stick with the precision of that 25-gauge needle or they can switch over to an Alger brush. It's this tiny, rotating tool designed to gently sweep away damaged cells. Both of these are fully approved techniques that students have to master to ensure the surface of the eye is left perfectly clean.
Which brings us to Section 2, the art of epilation, precision, and partners.
So, epilation. It's basically the medical term for plucking an eyelash. But here's the wild part. Students don't practice this on animal models. Nope. They actually have to remove lashes from the inferior lid, that's the lower eyelid, of their actual human lab partner, all while stationed directly behind a slit lamp. Talk about the ultimate trust exercise with your classmates, right? Practicing this requires some seriously steady hands.
The absolute golden rule here, straight from the syllabus, is that the most important aspect of epilation is to grab the lash at its base. Why? Because you need the root of the lash to be removed so the lash doesn't break. If you just grab the tip, you run the massive risk of snapping the lash right in half and leaving the root behind, which honestly completely defeats the whole purpose of the procedure. It's all about maximum precision to ensure that entire root comes out cleanly. All right, let's move into Section 3, the perfect saline rinse, the final challenge.
This brings us to a fantastic real-world logistical dilemma. Think about it. How do you make sure a reasonable amount of saline flushes the eye without the patient getting completely wet? They're sitting right there, upright in the exam chair. Executing a thorough rinse without soaking your patient's shirt? That is a practical art form all on its own. To wrap up this explainer, I really want to leave you with this thought on the ultimate trust. Just think about the intense, microscopic training these third-year optometrist students undergo. They have to master holding 25-gauge needles tangentially against animal eyes. They're plucking eyelashes from the lower eyelids of their classmates behind slit lamps. And they have to figure out how to flush an eye without spilling a single drop. Knowing all of this, how much more do you respect the insanely steady hands of your local optometrist? And honestly, you've got to ask yourself, would you volunteer to be the practice partner in that pre-clinic lab? It definitely gives you a whole new appreciation for the profession, doesn't it?